Acid reflux, heartburn, GERD, these are common symptoms or conditions that I see in practice every day, every week, several times. And a lot of people have these symptoms or conditions, but they just don't really know why or what's driving it. Believe it or not, one of the most common mechanisms of acid reflux and heartburn is low stomach acid and not high stomach acid. And when you look at just normal physiology, when we are teenagers, we have ample stomach acid. When we're 40 years old, we'll have about half of the stomach acid we had as a teenager, just naturally with aging. When we're 70 years old, we'll have about a quarter of the stomach acid we had as a teenager, naturally with aging. So when we look at, all the patients that are on PPIs and acid blocking medication, right? When you think about it, like, well, wait a minute, I have less stomach acid and having acid reflux, but yet I'm blocking the stomach acid that I have, right? It just doesn't seem to really add up. So you're trying to figure out what the mechanism is. High stomach acid is possible, especially maybe with an acute H. pylori infection, which is a bacteria that can resist stomach acid, kind of burrows into the lining of the stomach, affects those parietal cells that make the stomach acid. But long-term H. pylori typically drives stomach acid down, and that is one of the most common causes of acid reflux, heartburn, GERD. Another common mechanism is food sensitivities. Whether it's gluten, dairy, other foods that we're testing, we want to test for these things and not guess and try to figure out what might be driving that. One important concept to remember when we have low stomach acid, if that's what it is, there's not a great stomach acid test in terms of like data where we, for example, a stool test where they're like, hey, you have low stomach acid. Low stomach acid is you pay attention to symptoms, right? So some people, maybe they have heartburn, acid reflux. Maybe they get full really quick. Maybe they belch a lot when they eat or after they eat. Maybe they have bad breath in the morning. Maybe they have gas or bloating, constipation. There's a lot of different symptoms that can happen. Feel like a brick's in your stomach and won't go down, right? It just feels like that food's caught on the way down. But if we do have low stomach acid, one thing to remember is the stomach where it meets the esophagus, there's a sphincter called the lower esophageal sphincter. And if the stomach acid is too low, that sphincter remains open. And now stuff can easily come up. There's nothing really blocking it from coming up. And the reason why it would come up is if we eat something, say, for example, like a steak, stomach acid's job is to break that protein down. Chewing helps, right? The enzymes in the mouth help, like amylase and things like that, but mainly for carbohydrates. But it just starts to begin that digestion process. The stomach acid is very acidic and starts to break down that protein. Well, if we don't have much stomach acid, right, it's not going to want to move that down the chain very quickly, which is why we can get full quick. We can feel like the food's caught. We can belch and kind of get these air pockets and start belching. So that's one important mechanism to consider is, that sphincter remains open and that acid or that, some people have silent reflux. Some people have a frog in their throat. Some people get a chronic cough, right? Some people think that they're kind of getting hoarse. Their voice is getting hoarse, right? There's more subtle symptoms that don't necessarily have to feel like the burn of the acid and things like that. Sometimes it's the belching. So there's a lot of these other symptoms that can be similar in terms of the mechanism, but can present multiple different ways.
Do you see a pattern? So like you'd mentioned with bloating, people get more bloating at dinner versus the morning. Is that kind of the same with acid reflux?
Certain foods, right, for whether it's gluten or just high protein, that puts a lot of pressure on the stomach acid. Sometimes people can link it to certain food groups. But if it's after every time you eat and it's more of an immediate response, then you're trying to think about like, okay, is this coming from a low acid environment where I eat food and it's just, no matter what I eat, it can't break it down. So now I'm feeling kind of this indigestion or this, this reflux or this chronic cough or whatever it is. In the morning, sometimes it's not as bad just because, hey, we've rested all night, haven't eaten anything since 7 o'clock last night. And you give the gut, 12, 13, 14 hours of break. And sometimes, it handles breakfast maybe a little bit better. You get to lunch, eat a little bit more, maybe you get, some food sensitivities that you're sensitive to at the same time. But the time you hit dinner, sometimes it can overwhelm the little stomach acid that we may have. And again, everybody's different, right? Doesn't mean that everyone has low stomach acid compared to what they're supposed to. But it is a very common mechanism for acid reflux and heartburn. And by the time we hit dinner and maybe have a big steak or whatever we're having, and a lot of times dinner is our biggest meal for a lot of people, it can a lot of times put too much pressure, on that system. And if we don't have the stomach acid there, sometimes we can get a lot more uncomfortable. Not only the reflux or the heartburn, but also, feeling like, oh, we're really uncomfortably bloated, or I got, food feels like it's just caught right here. I'm belching all the time, whatever those symptoms may be. But yes, it can be more common as the day progresses and can be, most significant at night.
Can heartburn be dangerous if I don't get it addressed?
Chronic heartburn, acid reflux over time, things like GERD, depending on the severity and how long we've had it, right? You can get it up into the esophagus, and sometimes it can result in things like Barrett's esophagus. And it can change kind of like the lining, like the epithelial, kind of like the cell structure in that area. So that can be from kind of like the chronic acid reflux over time. So we definitely want to try to figure out why we're having acid reflux, get on top of it, do testing, don't guess, and try to get those symptoms to kind of be under control. When we block acid, that might suppress the symptoms. And a lot of people are on, PPI medications and stuff like that most people will tell you that symptomatically it kind of helps their symptoms. But at the same time, I have a lot of patients on those medications, and we want to still try to figure out why are they having the acid reflux and get on top of that, whether they're on them or not. We want to try to address the upstream problem with the downstream symptom. That's the biggest thing that we still want to try to figure out. And if we can get kind of on top of that, a lot of times we start to notice that the symptoms just, they reduce over time. Again, depending on how long you've had it, the severity of it, that dictates kind of how fast, typically people will see results and how many different things are driving that symptom.
And when I eat spicy food, it really hurts,
Mhm.
What is there anything you can talk to about why that happens?
Common foods that can cause, more issues in terms of like just GI discomfort, indigestion, maybe some nausea, sometimes things like heartburn too, is things like whether it's tomato-based things, alcohol, sometimes things like coffee or caffeine, but citrus fruits, spicy foods, right? These kind of foods. And the reason why they can kind of cause issues is because if that lining of the stomach is compromised or irritated, these foods are, like the spiciness of them, like the pH or the acidity of these foods, or the alcohol, those kind of things, they can kind of just irritate that lining. And that's why you get these more immediate symptoms. And so obviously one of the biggest things that we want to try to focus on is what can we do to limit the irritation so we can get the body to naturally help out, right? Get that innate immune system to kick in and try to do what it's designed to do, which is try to heal, repair, recover. There's, for example, gastritis just means, inflammation of the lining of the stomach. So that's a common one where you'll get these irritations, but we can use things like certain herbs to help soothe and heal. And that's where like coming in and getting tested to try to figure out like what's driving my acid reflux or my heartburn, my GERD, my gastritis, whatever we have. That's what we try to do to figure out like, is it coming? Do we have H. pylori? Again, H. pylori is an infection, a bacterial infection in the stomach that can burrow into the lining of the gut and really decrease stomach acid over time. And it can make us more vulnerable, to things like, acid reflux, heartburn, GERD, low stomach acid in general, sometimes gastritis, ulcers, those kind of things as well. So we want to make sure that we get on top of that and figure out, because that's one of the top causes of low stomach acid is H. pylori, this bacteria that's very, very common. About 50% of us have it clinically. But, the question is how many people is it affecting, like symptomatically, right? So we can do it through a stool test pretty accurately, and we can test and say, hey, is that part of it or not? Then we obviously want to look at foods. We want to look at the microbiome outside H. pylori in terms of, do we have, the right amount of beneficial flora? Is there too much yeast or candida, parasites, other bacteria? But also there's a marker on a stool test called elastase. That's your pancreatic enzyme marker, where that measures how much is your pancreas making for you of digestive enzymes. One of the most common reasons why that marker would also go low is because of low stomach acid, especially if H. pylori is there. Because remember, it's communication. Stomach acid, if you have the optimal amount, it tells the pancreas to make digestive enzymes. So if you have low stomach acid, it's not relaying that message, and the pancreas is like, okay, I don't have to make any, or not any, but I don't have to make as much your digestive enzymes. And so clinically, you can kind of get an idea where you combine the history, the symptoms with something like the stool test. You make sure that we're looking at H. pylori, food sensitivities, maybe stress, right? There's a, chronic stress response that, why is stress linked to ulcers, right? So you want to look at how is stress also affecting the gut as well? And nutritional deficiencies can as well, right? If we don't have the nutrients to repair the gut, then it's going to be a delayed response, or it's might not be able to do it as well as it could if it had those nutrients to be able to rebuild.